Welcome to yet another video of nurses here for NMC OSCE training. In this video, we are discussing about intramuscular and subcutaneous injections. It's very easy procedure and the time limit is 15 minutes. It can be asked as a part of one of your skill demonstration. Starting the procedure. As for every other procedure, the first thing you have to do is scene safety. Entering to the patient room, checking for scene safety, ensuring that scene is safe to approach. Next thing you need to do is hand rub. Make sure that you follow the 7 steps of hand hygiene while you're hand rubbing. Then you need to introduce yourself as an attending nurse for today. Next thing, you have to ask the patient their name and date of birth. And you have to ask them what they like to be called of. While checking the ID band, you have to also check that whether there is an allergy band present on the patient hand. You need to address for any allergies. If they have any allergy, please tell them that you are not going to administer any of the medication that they are allergic to. Next, you have to tell about the purpose of your visit, that you are going to administer a medication or injection and gain their consent. And tell more about the medication that you are going to administer. You also need to ask whether the patient is in any pain. If they tell that they are in pain, use the pain score. Ask them whether they need any medication for that. Next, you need to protect the privacy and dignity of the patient by closing the doors, curtains, and blinds. You have to tell the patient that the possible duration of the procedure is 15 minutes, and if you need to use any toilet, you can do so now. Next, you need to tell more about the injection you are going to give. You need to make sure the patient or the examiner that whether the medication is previously administered or not. Next, you need to explain about the sites commonly used for the injection you are intending to give. Also, you need to the site which was last administered. Then you need to inspect the site which the patient chooses. You need to inspect for infection, inflammation, or past surgeries on the site. If you are going to give insulin, confirm with the examiner about the last blood sugar value. Then tell the patient that you are going to assemble the things for the injection and you will be back. And if they need anything, they can just press the call bell and you will be coming by. Next, you are going to assemble your things. First, you do a hand rub. Put an apron on and a gloves. Then you need to clean only the tray, not the trolley, because injection is a clean procedure. If the tray provided is disposable tray, there is no need to clean the tray. Confirm with the examiner that the tray is cleaned with soap and water in past 24 hours. Clean the tray with alcohol wipes after checking the expiry of the alcohol wipes for 30 seconds and allow it to dry for another 30 seconds. Remove the apron and gloves, perform a hand rub, and read aloud the prescription for the examiner. Then, usually the examiner will confirm that the tray is dry and clean and ready to use. Next, you have to assemble the things in the tray after confirming the expiry of each item. You need to have a syringe for subcutaneous or IM injection. Then you need to have the medicine. While taking the medicine, check for precipitate, and you need to document the batch number and expiry of the medicine. Then need to have loading and administration needles. Sometimes you will get an insulin syringe if you are administering insulin. So there will not be any use of loading and administration needles. For IM injections, take 21 gauge needles or 23 gauge needles for administration. For loading, usually take 18 gauge needles. For subcutaneous injections, take 25 gauge needles. Then you need to take the alcohol swabs. For subcutaneous injection, you can use the alcohol swab to clean the neck of medicine, usually in an ampule. For IM injections, you can take 2 swabs, one to clean the medicine and one to clean the site. Then you also need to take a cotton ball to press the site after giving the injection. Make sure that you don't massage the site. Then you also need to take a pair of gloves for administering the injection. So your tray will contain a syringe, the medicine, loading and administration needles, alcohol swabs, cotton ball, and a pair of gloves. After assembling everything, you need to load the medicine without making it unsterile. Wipe the neck of the ampule with the alcohol swab for 30 seconds and allow it to dry for another 30 seconds. Confirm with the examiner that the ampule is ready, cleaned and dried after 30 seconds. Load required quantity of medicine using the loading needle, remove air bubbles and then change to the administration needle. Make sure that you are not discarding the medicine. Your loading needle need to be recapped using 1 scoop method and discard it in the sharp bin, verbalizing that the sharp bin is not full. Confirm with the examiner that medicine loaded is in the required amount and there are no air bubbles. Discard gloves, perform a hand rub and take the tray to the patient's side. You have to identify the patient for the second time. You have to make sure that the patient is same which you have talked before. So identification of the patient is a must. After identifying the patient, just perform a proper hand washing at the wash basin provided using 7 steps of hand hygiene and wearing an apron. Then you need to expose the site. After putting on a gloves, then pinch the tissue 2 inches. Only for subcutaneous injection, hold the injection like a dart at 90 degrees. Administer the injection slowly at the rate of 1 ml per 10 seconds and hold the needle inside for another 10 seconds and withdraw swiftly. You need to ask the patient to take a deep breath while giving the injection. You need to poke the needle while he is expiring slowly. Verbalize that the site is clean, there is no need to wipe with alcohol swab. Also, you have to tell that the patient is not immunocompromised and there is no need to wipe with alcohol swab for a subcutaneous injection. But know that you need to wipe the site always for IM injections. And there is no need to aspirate for blood in subcutaneous injection. That is applicable only in IM injections. Don't insert the needle fully. Keep it 1 centimeter away from the hub of the needle. Just press a cotton ball soon after withdrawing the needle. Don't massage, just press. Verbalize that there is no oozing from the site and no need of putting a plaster on cotton ball. You need to verbalize everything you are doing. Tell the patient that the procedure is over. Discard shaft immediately. Don't recap your administration needle. Just discard the sharp along with syringe, verbalizing that the sharp bin is not full. Tell the patient that you are going to discard the used items and will be around for another 30 minutes and tell to press the call bell in case of any adverse reaction. Next, you need to discard the waste in clinical waste considering ampule as sharp. Mostly in the examination scenario, you will be given a plastic ampule. But you should discard in the sharp. Document that prescribed drug is given by ANTT mentioning date, expiry date, batch number, time and sign. Don't forget to do your hand washing before leaving the room. Let me tell some more points to note in the case of injection skill. Common sites of IM injection are ventrolateral aspect of deltoid muscle in both arms or ventrolateral aspect of mid-thigh. You must know that intramuscular injection is not administered in gluteal site in the NHS. For IM injection, hold the syringe like a dart at 90 degrees with your dominant arm and stretch the site with 2 fingers of your non-dominant hand. For IM injections, you need to clean the site for 30 seconds using alcohol wipes and wait for another 30 seconds to dry. Also be aware of the key points. The key points include the hand washing technique, the allergy check, education about medicine, discarding of sharp, documentation with expiry date and batch number of the medicine, warning of allergic reaction, proper technique of injection administration, and choosing of site. Thank you for watching this video. Please don't forget to subscribe our channel OSCE for NMC Part 2 for more videos.